Hello, my fellow chiropractors. I'm so excited to be a part of this presentation here, and I'm just elated for the fact that because of ChiroSecure, I'm going to be able to share with you a lot of wonderful things about pregnancy, later on about kids, and how to raise a healthy family wellness practice. My name is Dr. Claudia Anrig, and I'm actually the leader in this particular category. Over 35 years ago, I created the category called Family Wellness Chiropractic. And because I've been teaching it for decades all over the world, I am so glad that you're joining me on this particular moment to hear about common disorders with women. Now, many of you know me because you followed me through the textbook one, Pediatric Chiropractic, the second edition, or the third edition, which is brand new right here, our third edition. And you can get that on Amazon.com. Very wonderful, some great new authors in this area. One of the areas that I believe is so important to learn is about common disorders and how to help our pregnant women. And so, docs, I'm going to take you through some just common sense stuff, some common disorders, and so forth, but also how you can maybe communicate this in your adjusting room. And maybe I'll give you a few tips if I was adjusting your patient, where I would go to maybe help this area out. And so what I'd like to do is go to my slides at this time, and so that I can present to you the 6 common prenatal symptoms and a natural approach on pregnancy. Not that we want to be, if we're a holistic wellness, family wellness chiropractor, do we want to be symptomatic? But a lot of our pregnant women do have symptoms. So, just as a side note, too, if you're having a preconception chiropractic practice, and we'll talk about that at a later show, we want to realize that many of those women, because they've been adjusted by you on a regular basis, that these particular women have a tendency to have less of these signs of symptoms. But we want to cover the top 6 and how we want to try these women to do more natural things like chiropractic, nutrition, manage stress, and of course, that powerful chiropractic adjustment. So, one area that is very common for the pregnant moms is headaches. As a matter of fact, you'd be really super surprised statistically, these moms are about 40%. That's a lot. And if you could see here, hormonal changes, some of it's triggered on by depression, sinus, allergies, exhaustion, fatigue, eye strain, increased hunger during the pregnancy. Another cause for these particular headaches is maybe dehydration in their last trimester. And so again, when in doubt, one of the things that we should ask our women to do is always carry a healthy amounts of water wherever they go. And even if they have a career job, that they can't always drink a lot of water because they can't stop to basically tinkle. We want to have them hydrate then first thing in the morning. Sometimes with my flight attendants, my pilots, my teachers, often they, in their world, they can't even stop to use a restroom because of their jobs. Even busy chiropractors, they can't leave to use the restroom. So I always recommend, when in doubt, hydrate just glasses and glasses of water before they start their day, so at least they're hydrated up, and then they can urinate through the day and maybe decrease that likelihood of headaches. Also, too, one of the areas that we have to, as we see screen time going up for these women, a lot of them, as you know, their chin is down. And when the chin is dropped down, depending to who statistically you're reading, that's about 60 pounds of weight on the head and on the neck area. And so we need to get what we call chin up. One thing that you could do if their headaches are being triggered by a biomechanical thing, I instruct my women to, or men, to bring their technology, let's say not a tablet, but their handheld device, bring it up to their chest, and then bring the device to their top, so they're looking eyeball to eyeball, no chin down. When I was in practice 20, 25, 30 years ago, I never had to give them that kind of instruction. But now, with just the changes culturally as a chiropractor, we just have to stay contemporary with them and what best we can do for them. Of course, getting them under regular chiropractic care would be so helpful. Does this a particular woman need to see you weekly? Every other week, so that they can keep their alignment, so that the nervous system is functioning well. Most of you, because you're just so good at palpating and finding the subluxation pattern, I'm going to guess that you're going to be somewhere in the cervical, but also many of you might be looking in the upper thoracic area, that T1 to T6, because if she's got a rolling shoulder forward and then she's jutting her head forward or anterior, as much as you could adjust the cervicals until the cows come home, you're going to have a problem. There's no stabilization because of upper thoracic area. So another thing that you can do for head posturing, and again, we have to be practical. These people have careers or they're maybe home raising their family. What if you suggest for thoracic posturing, doing some really quick, what we call wall push-ups? Now, I don't recommend going, although you can do fingers up the wall. My suggestion to get a good expansion to the chest, go finger to finger, and then they're doing the wall push-ups like this, and that'll help them engage better thoracic posture. Just a simple tip on helping out from the chiropractic perspective, because we know there are three causes of subluxation: physical, chemical, and emotional. And as a chiropractor, who better than us to give them these kind of advice? What's really sad is in the average individual, they think, well, if I can buy it, over the counter at my grocery store or CVS or a Walmart or wherever it is, these medications should be safe. Well, the Tylenol risks autism, ADHD to the unborn child, fertility problems. So this is something we should avoid anything over the counter. And then the Motrin, Advil. Look at the side effects. Doctors here: risk of birth defects, heart damage, particularly in blood vessels. And so we want to avoid that, even though it's so odd in the medical community, the OBs, they just or the nurse practitioners, nobody warns these women that they shouldn't be taking something over the counter, something like they could be their own doctor, mom, and so forth. That is just uncalled for. So we have to, again, find out what their triggers are, get them on a regular adjusting basis. And then also, too, what if you could come up with something more natural? Do you have a natural product that you like to take? If they're going to be treating pain with any of these drugs, what about recommending maybe over the ordering like the tablet homeopathic for arnica, pain control? So just some thoughts as we want to cleverly give our patients some good ideas. Migraines is also a part of our patients' problems, and the migraine sometimes at a level where it's about 10% of the population. Know their triggers. Find out too if they say, doc, I'm having migraines. My question to them is, did you have these migraines before a pregnancy? Was it ever related to your periods, right before, during, or after? Did you have a pattern of migraines? And if so, note that, because then she has a pattern there that you need to start looking for maybe something differently and adjusting. I know when it comes to my classical training of Gonstead, Dr. Clarence Gonstead would talk about to the docs when he was training that often how he would help somebody physiologically with the migraines was, he always says, docs, go look at the lumbar spine, lumbar vertebra 3, 4, or 5. It's a hormonal issue, migraines. And so if you're doing some really great work in the cervical spine, but you don't seem to be able to nip the migraine, go the other end of the nervous system and look for hormonal changes with the fact of lumbar 3, 4, or 5, and see if you palpate that, you might find a subluxation pattern there and just change your adjusting. One of the things that we have to really work on with them too is to have them maybe write down a journal, what they're eating and what they're drinking over a period of a few days. You might find that they have a pattern with this. Is also true for headaches or migraines. They eat a certain way Monday through Thursday, and then starting Friday through Sunday, their pattern changes. So always know that over a weekend, if that pattern changes with increase, maybe sugar, increase chemicals in foods because they're going out, find out how they're living their lifestyle, because part of our responsibility, we know that there are three causes of subluxation and one of them is chemical. We need to know what their intake is of fluids and what their intakes, docs, are on the foods that they eat and maybe restaurants they go to. One of the areas that we can help them out too is avoid the triggers, and that comes to journaling. So a journal is always something wonderful and easy to do. How are we going to manage their stress? I mean, right now anymore, you could, between YouTube and an app, maybe they can get a breathing meditational app that helps them to guide them into gentle breathing. So even at a busy schedule at work, I even have my patients who are always at the desk, hardly can get up and move from their workplace and so forth. I have them do a little pop-up that, every 50 minutes, get up, walk, and breathe. And so just something simple as that, your suggestion, and see, when we give our patients, this is one of the things I do with my generations members, is one of the things that we can do is sometimes we give an idea, but we don't teach them how to fit it into their lifestyle. And if we have a really great relationship with this patient, we who better than us is to show it how we can fit it into their lifestyle. It's make it a positive, not just a command, pointing a finger, you better do it this way. Rather, show them, open up the door in a way that makes it easier for them to make this kind of choice. And then also, let's get that straight. Make sure they're avoiding not skipping any meals. Make sure another one too is eating a lot of protein, whether it and fat. So the protein coming, again, whether it's a meat protein. If they're so busy, having the protein of having an egg, a hard-boiled egg, have something extra in a refrigerator so they can go really quickly and do that. And I'm a big fan anywhere in a pregnancy, whether it's migraines, headaches, and other symptoms, you can never go wrong with beef bone broth. Beef bone broth, preferably they would make that themselves, but anywhere that they could source it for organic, that would be great as well. And then also don't steal your sleep. I'm a firm believer again of moving away from technology. Honestly, I think when people walk into their homes, other than maybe watching a show or this or that, I mean, technology down. I mean, let's put that thing away, because the more stimulate you are looking, at all your social media stuff, then you're stimulating the brain, or they're looking on something, or they're, oh, I got to order this. Well, when did they ever get their brain to quiet down? And so we need to quiet them, and the best place is shut it all down, because if you do, it's going to push away. And why I can say that is, look, I've been practicing for decades now, and so when there was a time in my passage of my season of my life as a chiropractor, nobody had technology. Yes, there were television programs and all the rest, but it wasn't the technology that's at their fingertips all the time. And so that's a part of our problem, is that people have higher stress, all these things, and this doesn't help with the headaches or migraines. We need to suggest them going in a different direction. Another one is to watch out for caffeine. Boy, is that a big one. Some women will sneak it into their lifestyle, whether it's a soda that they just can't give up, to the coffees or to the teas. So we don't want it. Sometimes women will say, I'm going to increase my caffeine, or go the opposite, withdrawing from it too quickly. So either way, caffeine has to be in fine balance. Ideally, if you were doing preconception, we talk about eliminating caffeine altogether, but that's for another show that we'll present for you. Another area of subluxation, pattern number 2, is low back pain, symphysis pubis pain, or even pelvic floor issues. And these women just come to expect that I'm going to have some lower back issues because I'm pregnant. Oh, all women have to have that. But again, because I have a preconception prenatal wellness practice, I never talk about low back pain. I never ever once had a woman with severe symphysis pubis pain nor pelvic floor pain. And I believe that's because, number one, we were under wellness care before conceiving. Number 2, I was giving them really great ideas for exercises and stretches and so forth, that they needed some help and so forth. But I just wanted to share with you, there are so many things that women are doing wrong with their pregnancy. Let's talk about the subluxation pattern number 2. When it's lower back pain, if we look in the medical community, this is one of the things that they'll say is a trigger. It's weight gain. They're going to blame it on posture changes. Well, who better than a chiropractor to help with that? Third, hormonal changes. Well, as a chiropractor, we could help with that if we're adjusting the lumbar spine. The muscle separation, they'll say, well, that's going to create some low back pain. That one, if she's more fit, has stronger abdominal core, she's probably less likely to do that. And the third, or the last one, would be stress. And again, that's something, as you can encourage, find out what her main triggers are. I always ask women, if you could give me your top 3 or 5 stressors, are they short or long term? I'm going to try to make a recommendation. How can we shift that stress and decrease it for them? Docs, even if we go to WebMD, their suggestion is exercise, an ice pack, improve your posture, acupuncture, and guess what? On WebMD, they say go see a chiropractor. So that's not so bad. We're on the map, if you could say. Well, probably not. But anyway, it is guiding people to come in and seek in chiropractic. So a lot of times what they'll do is they'll try exercise and they'll try the cold. and after everything else has failed, often they'll show up in a chiropractor's office because they know, as these in our social world that's out there, more and more people are talking about seeing the chiropractor during their pregnancy. So that's the good news. We are seeing more people coming out to see us. When it comes to symphysis pubis pain, and that's at the very bottom, doctor. Imagine when it's not related to separation, but majority of the time they say it's 1 out of 300 women may have this diagnosis. But basically, many experts say they think it's up to 25% have a symphysis pubis pain. Because I am a practice that does X-ray, not during pregnancy, obviously, but postnatally, if I have somebody who comes in that has severe symphysis pubis pain, or a pain intercourse, and whether they're pregnant or not pregnant, what I have found postnatally for the severe symphysis pubis pain women, when I did an A to P film and a lateral on an A to P X-ray film, and I did a measurement of the pelvis, I've always have found significant, doctors, sacral rotation, not like 1 to 4 or 5 degrees, but if you're doing a classical Gonstead analysis, I'm talking like 12 or 15 rotational. It's unbelievable. So I want you to think about it. If you're not getting results on it, double check on your palpation on sacrum rotation, and let's do a more specific contact point. Are you getting right on the ala of the sacrum? That's between the second sacrotubercle and the PSIS. You got to get your pisiform right on there. Or if you do drop work, you have to, whether pisiform or thumb and thumb move. What you want to do is you really want to get that rotation diminished. And again, if you're not getting these kind of results postnatally is with the women, I'd recommend, even if you don't do X-ray, refer out. Let's just do some measurements and see if that's something that you could correct. But symphysis pubis pain is something very helpful. Also, at a later show, we'll talk about it too. Another reason why a woman could have symphysis pubis pain is if the baby in the last trimester has gone down in a face or brow presentation, because now the weight of the baby's head shouldn't be in that position, is weighing on above the symphysis pubis. So just a little tidbits for my chiropractors. So in symphysis pubis pain, avoid the triggers, like if there were certain positions, chairs, couches, things that are not helpful. For some women, maybe they'll wear a support belt. Do the pelvic tilts, the Kegel exercises, and of course, they need to have chiropractic care. So when it comes to pelvic floor, docs, this is an area that has become an area of interest and so forth. I think we're talking more about pelvic floor dysfunction. It's interesting, if you were in countries like in France, majority of women who have a pregnancy, right after pregnancy, all of them go see a pelvic floor physical therapist to make sure that everything is taken care of because of the birth process. But for us, when it comes to physical, because of pelvic floor, it can cause urinary, fecal issue, or prolapse and so forth. And so what one of the areas, again, is the key would be a preconception chiropractic practice. So you're getting them in a healthier position, but the key is also then education. One of the areas that we also found is that, and this was a paper done by Dr. Heidi Havoc. She's a PhD chiropractor. Dr. Heidi did a paper, and she took a group of pregnant women, and then she did a group of non-pregnant women, and all of them got a short lever adjustment, side posture adjustment, short lever with just a high velocity adjustment there. And what she found is that the women who received in their pregnancy a short lever adjustment, that the pelvic floor actually relaxed. And if the pelvic floor was relaxed, her theory and her paper basically says that if more women were receiving chiropractic care, there might be actually less obstetrical intervention. The number one cause of pelvic floor injury, doctors, is related to, unfortunately, the use of the hands of the OB delivering the baby, forceps, vacuum extractor. It's them getting involved. So Dr. Heidi's paper suggested, gosh, if more chiropractic could be used, maybe there'd be less use for obstetrical intervention, which would be a really great thing. And so this would be a tool to use. So again, the Heidi Havoc paper, and the specific adjusting wasn't iliums, it wasn't the lumbar, but it was a sacrum adjustment. So we want to look, palpate better there. And again, whether you do drop or side posture, which by the way, all of them have been known to be safe for our adjusting chiropractors out there. So there's not a technique that one needs to use, just using the technique that you get the best results. So sometimes it might be in your population group of adults or in pediatrics, you use a certain kind of technique. But if a woman is pregnant and you're not getting the results you're not getting the pregnancy results, it might be that you need to add another tool in your toolbox in adjusting so that we can get better results for the woman. Docs, again, going back to Heidi's paper, pregnant women getting their sacrum adjusted very specifically and it relaxing the pelvic floor. And so that means we'd be less likely to have pelvic floor issues. However, as a side note, I do believe that every chiropractor, just for the results for your pregnant moms, you want to have a physical therapy, a pelvic floor specialist, somebody you could refer to if your patients are not getting the kind of results and so forth. They just need that field of specialty so that we work like a tribe. We work as a team on the benefit of our patients. What's also interesting when it comes to low back pain, symphysis, pubis pain, and all the rest. There have been more studies done on the effectiveness of chiropractic adjustments with medical community, the OB community. As a matter of fact, more published papers are in the benefits of chiropractic care, helping with low back pain, symphysis, pubis pain, all the rest, than any other papers that have been published. So, there could be really a big openness. Doctors to OBs may be referring to your practice because of these papers. And then the last thing areas here to look at is knowing that pelvic floor exercises are important. You can just Google up those kind of information, what's out there for the exercises. I'm a firm and committed to the areas of pelvic tilt, squats, Kegel exercises, even the butterfly and so forth. If you have our third edition of the textbook here, docs, if you'll go to the pregnancy, the prenatal exercise chapter, we have a ton of just that chapter alone. You'll have a ton of information in regards to all the exercises in pregnancy for pelvis, for upper body, and so forth. So you certainly want to look at that and look at that chapter and so forth. That'll help you get some more tools so that maybe you can show them. So that's, again, a good offset on helping them and just checking them, whether you're checking them twice a month, and so forth. I think that's more of a prenatal wellness adjusting schedule is at least every 2 weeks. I think if women go once a month, that's too far out. And some women may not need to be over adjusted like once a week. So you have to find that happy medium with their body, your technique, and what's the best for that mom and so forth. And as we're kind of winding down our show right here, one of the things that we're recommending is, again, get the third edition of the textbook. It's unbelievable. We've added so many wonderful chapters in there. We have tongue tie. We have breastfeeding. We've added Heidi Havoc on subluxation, a contemporary look at that. For those of you who have the second edition, we've also added on from second to third. You see toggle there. You're gonna. We've added toggle to our work, and so we extremities, and so we're very excited. So there's just a wealth of information for you to go back and have a reference tool, and then also, last but not least, come check me out. I've been at this for decades, and I'd love to show you my stuff that I have out there. So if you go to my website, Dr. Claudia Anrig, where you can go is you can find out my homepage, find out about generations. I mentor doctors for the last 20 years, and I literally taken people from zero patients to seeing a couple hundred patients a week, to getting associates, to creating just 100% cash practices with just pregnant women and children. I mean, I have done it all, big cities, little cities. Check me out on generations. And then, of course, I have a seminar series called First Adjustments. I do about 3 or 4 of those a year all over the United States. And so just check it out where I might be at in that particular year and so forth. And if you have any questions, just email me. I'd be happy, as you being my colleague, if there's any questions I can help you on a case, don't hesitate. I love figuring out the art of a chiropractic adjustment. And again, I want to thank so much from the bottom of my heart for ChiroSecure, an amazing company that has been serving our chiropractic profession for decades. Thank you so much.
This pediatric show, Look to the Children, was brought to you by ChiroSecure.